Further supplementaries, or shall we move on? Question number 8, Dr. Shane Reti.
Thank you, Mr. Speaker. To the Minister of Health, can he confirm that there has been 190,807 more children's visits to the GP, an increase of 16.6% in the last 12 months since the government introduced free GP visits for under 13s?
Speaker.
The Honourable Dr. Jonathan Coleman.
Yes. Back in Budget 2014, we committed $90 million over 3 years to extend free GP visits and prescriptions to children aged under 13. As a result, we now have more than 780,000 children under 13 benefiting from those free GP visits during business hours and also from free prescriptions, with over 99% of general practices signing up to the scheme. Importantly, this data shows that there has been a 17.1% increase in visits for Maori children and a 13.5% increase in visits for Pacifica children.
Supplementary question, Dr. Shane Reti.
What positive effects has the introduction of free doctors' visits and prescriptions had?
The Honourable Dr. Jonathan Coleman.
As a result of the under 13 visits, we've seen an encouraging decrease of 1,600 presentations to hospital emergency departments. That's a drop of 4.7%. We've also seen an increase in access to medicines, with the number of prescriptions dispensed increasing by 23.9%, showing that the removal of costs has improved access to medicines. It's clear that the Free Under 13s policy is supporting the government's strategy in health, which aims to have interventions delivered much earlier in a community setting, which means that children are prevented from getting more sick, and that's got to be a good thing.
Supplementary question, the Right Honourable Winston.
When will his government acknowledge that this visionary, far-sighted, inspirational policy came from New Zealand First and delayed as to 6 to 12-year-olds only by an obstructive, jealous, recalcitrant National Party?
The Honourable Dr. Jonathan Coleman with pleasure.
Probably never.
Question